Thanks very much, Karen. Hasn't this been a really fantastic conference? Thanks to all of the organizers for this. I'm going to speak to you for a minute or two as a health systems person, because I'm not going to tell you what you already know, because we've already talked about it, but I'm going to tell you why what happened today, what happens, the work that you do is so tremendously important. And then I'll give you some of the nuggets or some of the themes that I pulled out. But first of all, I said I'm from the health system, by which I actually mean I'm from the illness care system. 89% of the Alberta Health Services and the provincial healthcare budget is spent on fixing broken things, on illness care, and only 11% on health care, just to remind you. So whose job is it to provide health and maintain health and make us healthy? The other thing is that there are various definitions of health. So what is health? Well, the World Health Organization tells us, some version of it's the presence of physical, mental, spiritual, etc., wellness. But Costa Rica really has a good definition of health. And their definition of health is a state of wellness that is created by the community. So I'll say that again, a state of wellness that is created by the community. So again, that's you, that's us, that's all of us. So I heard there's sort of three themes that I picked up on that under which we could sort of categorize, or I'd categorize the discussions today. One was around activity, one was around connection, connectedness, and another one was around pleasant spaces. I couldn't think of a better term for that. So I just wanted to talk briefly about each one. So the first one around activity, and I'm trying not to say physical activity because that's too close to exercise. And let's be honest, none of us like exercise, right? Some people think they like exercise, but what they actually like is like banging your head against the wall. It hurts while you're doing it, but it feels good when you stop, right? So activity, pleasant activity. Now I'm going to switch hats. I'm going to stop being a health systems person. I'm going to be the university professor. So my training is in endocrinology and hormones, and I happen to have a PhD in physiology. So I'm going to give you a little bit of a university lecture. So why is activity good for you? Why is activity good for us? Well, we all know it is, and some people say, well, I hear it prevents heart disease, and I hear it prevents obesity and prevents diabetes. Well, actually, we know the reason why it is good for you, and in so many reasons. So I'm going to tell you why, and I think that's really helpful in motivating. So as a hormone doctor, we know that there's glands like the thyroid gland that produces thyroid hormone and the pancreas that produces insulin. It turns out every part of our body produces hormones. Even the bone, which we think is sort of inert, the bone produces 50 hormones. Turns out your muscles produce hormones as well. And what are some of those hormones? So when you are active, when you go out for a stroll, because I want to use pleasant language, not exercise language, go out for a pleasant stroll. As you constrict your muscles, it's like squeezing a tube of toothpaste. The toothpaste comes out, but hormones come out of your muscle. One of those hormones is called brain-derived neurotrophic factor, which is just a fancy name for a hormone. And what it does, it's the cleaning lady of your brain. It goes to your brain and it picks up the garbage, puts it out, sweeps up all the dust and the dirt, it polishes everything nice and clean, and at the end of it, you've got a nice, clean, shiny brain. And what does that do? It gives you mental clarity. You can think better, make better decisions. It's been shown that's why exercise. That is the mechanism by which physical activity prevents dementia, helps dementia, and even can reverse some of the symptoms of dementia. So you've heard activity is good for dementia. That is why. Another set of hormones affect the brain neurotransmitters, something called serotonin and dopamine. And so what that does is that improves your mood. So it increases those happy neurotransmitters in your brain. Physical activity is more effective than the antidepressant pills that we have. Plus it's cheaper and it has no side effects. You've heard activity improves your mood, improves your mental state. That is why we understand, we can explain the link. Another hormone produced by muscle is called irisin, and that hormone improves would be a really long explanation. Let's just say it improves your metabolism. So it helps control weight, prevent obesity, prevent diabetes. You hear about activity burning calories. Well, yeah, sort of, but not much. But what this hormone does is it stimulates your metabolism for up to 72 hours after. So half an hour of exercise, 72 hours of benefit. And finally, this time of day, and a lot of people say, come home, I'm just too tired to exercise, too tired to go for a walk, I'm just exhausted. What you're actually saying is you're feeling the symptoms of low-level inflammation. And guess what the treatment for that is, of that low-level inflammation? There's a saying that runners have is, I'm tired, I need to go for a run. Because physical activity suppresses that low-level inflammation and it turns on the good parts of your immune system, which prevents things like flus and colds and COVID. So the paradox is, I'm tired, I don't want to be active. The treatment is being active. So those are all the reasons why being active and enabling and facilitating activity is so good, as you have been discussing. And what you've been discussing is, how do we facilitate that? How do we enable that? And I've learned so much here, and I've learned so much previously from many of you about those enablers and facilitators. So I learned, okay, well, if we're going to enable, how do we let people walk? And so I've learned things from Robert about people, particularly older people, or people pushing a baby stroller, for example, or with a cane. You walk along now in our districts with the sidewalk nice and flat, and then of course we have to drive our cars up into our front driveways so the sidewalk tips. Now imagine in your wheelchair or pushing the stroller, particularly now add in snow and ice to the mix, and we certainly haven't helped or enabled the walking. So what are the things that can be done there? Curbs, same thing, stepping down with curbs, strollers, walkers. So we have curb cut downs as an example, but not all our areas have those. Snow and ice is one of the big impediments, of course, and we could go on and on. So that's sort of your area, your purview is, how do we enable and facilitate that type of activity? How do we make it easy to do the right thing, so to speak? Now, the other thing then was on connections and improving connections, connectedness. Who here wants to pay more taxes? Nobody. Apparently our election also confirmed nobody wants to pay more taxes. Single biggest line item in the provincial budget is healthcare, and the single biggest line item in healthcare is hospitals. And the single biggest predictive factor of admission to hospital amongst the group that is admitted the most to hospital, which is frail elderly and older people with multiple chronic conditions, the best predictor of hospitalization has nothing to do with their medical state, actually turns out to be loneliness. Loneliness is the best predictor of hospitalization. How much does it cost to treat loneliness? Should AHS hire a bunch of loneliness therapists, or could the community do that? Could we do it to our neighbor, for those of you that believe in asset-based community development? So same thing with loneliness. We know that, and they've done these studies, taken people, put them in fake solitary confinement for 1 month, and we can see all sorts of genetic changes and changes to the things that control genes and all sorts of changes in the immune system. The scary thing is, after the month, when they say, okay, the experiment is over, those changes weren't reversible. So we now understand there's a physiological explanation why loneliness and social isolation is bad. The problem is we are becoming more socially isolated and lonely. I was just in a conference in Belgium. They predict 50% of Belgians will be living alone in the near future. So we've talked about facilitating connection, facilitating interactions. So that's tremendously important. The loneliness, that impact has a physical impact. That same loneliness leads to that low-level inflammation, which leads to conditions like obesity and diabetes and heart disease and cancer. All are big diseases just from loneliness and social isolation, believe it or not. So everything that we can do and you can do to facilitate social connection and connectedness is really important. I'm going to come back to that in just 1 second. Pleasant spaces, well, why not live in some building that is pleasant, or a community that's pleasant. We don't want to live in some dystopian place with, bare fields with needles in them and broken windows and burnt out streetlights. Like, well, there's nothing wrong with wanting to live in a pleasant location, to go for a walk, not in the industrial area, but in a pleasant walking park. But coming back to the loneliness, social isolation, somebody in one of the questions said, well, okay, we can build these things, facilitate connection, but how are we actually going to get people to connect? Well, there's a few ways of doing this, and you can come up with others. One way is pets, particularly dogs. So Vancouver, and I believe Edmonton, facilitates pet ownership, because what happens when two people walking down the street with a dog, each with a dog in the leash, when they meet each other? They'll talk, right? I challenge you to walk out there, go up to a random stranger and start talking and see what happens. So that gives you an excuse to talk to each other. Plus it gets people out at least once or twice a day for physical activity. So it enables that. There's other benefits that enables them to go outdoors to see green, which I'll touch on in 1 second. And it's said that there are 3 things necessary for happiness. The 3 things necessary for happiness are something to do, something to look forward to, and something or someone to love. Not to love you, that's maybe number 4, but something to love. So what do pets do? Gives people a reason, particularly people that are socially isolated or living alone, something to look after, a reason for existence, a purpose in life. And in return, they get the love and affection of their pet. But it's not even necessarily pets. We know that in some of the senior centers or places where people can't have pets, plants can actually fulfill that role. That's just an example. So being able to facilitate pet ownership has many, many benefits. Anything that we can do, we talked about things to look forward to, things to do. Gardening, we know it has its own intrinsic benefits, studies have shown, but gives a person something to do, something to look forward to, a product at the end as well. The other thing is, the last little bit is pleasant spaces. So just to come back to that, well, what are pleasant spaces? There's something magical that we don't understand. So sorry, I can't explain the physiological linkage here, but the color green does have a measurable calming type of an effect. And particularly green when it comes in the form of plants and grass and foliage. Studies have been done in agitated dementia, agitated psychosis, schizophrenia, and they found there's really only 2 things that really are effective at calming people down. One is human touch, and the other one is going out in green space, outside into green areas. If you go to the Glenrose Hospital here, you'll find that they've got almost jungles that exist in the dementia areas to help with that as well. So that's the reason why having green spaces is also important. So everything in our society all contributes to our combined wellness. The parks, the open spaces, the ability to walk and enjoy and recreate, and the accessibility. So if you live in one of the rich, things to be able to do things. When you hear about communities sponsoring events that cost nothing. A lot of times, to go to this event or that event, you have to pay money. But to be able to have something to look forward to, something to do that doesn't cost, that is run by the community or sponsored by the city. Mayor Bob Young from Leduc throws open the doors to the Leduc Recreation Center to young people free of charge. City of Edmonton for seniors up to 4 o'clock, I believe. So enabling people to participate, have something to do are also things that are helpful. So I've probably rambled on too long, but just to reemphasize that Karen's idea of the task force, I think, is really important. When the federal government doesn't know what to do, they hold a royal commission. When the provincial government doesn't know what to do, they form a committee. And when AHS doesn't know what to do, we hold a meeting. But Karen has assured me that the task force is a doing group, people that will actually put into action all of the fantastic ideas that have been discussed and come up with today. So. I feel very privileged to have been a part of this meeting, and thanks very much again to all of the organizers. Karen.